Hi friends, in this session we will be covering image based questions that can come from trachoma. This is a quick session just for it's gonna be exam oriented session. Okay. In detail, I'll take another class. So, in trachoma, what are the images that can come in your paper? Trachoma endana? It is a chronic bacterial infection of the eye. Which bacteria? Chlamydia trachomatis. So, because of this chronic infection by this organism, our immune system will start to fight against this infection, and this immune response can cause some changes in the eye. Adana image based questions usually okay, basically against this bacteria in our immune system, the patient's immunity starts to react, and because of that certain changes, immune response certain changes can occur in the eyes, and those can come as your questions. So chlamydia has got many strains, okay, A, B, C, D to K. Another A, B, C. These strains, these serotypes, they cause what? Trachoma. Okay. Now, how does trachoma spread? That is poor hygiene conditions. Trachoma, it can spread from person to person. That is if a patient has got eye infection, he touches the eye, then he gives you shake hand, and then you touch your eyes, it can spread that way. Shared objects, poor sanitation, shared water, shared towels. Okay, so what are the clinical features? Quickly, see, first thing, because to fight against this infection, the immune system will come. Infection evideyana? Kanninatte conjunctival infection starts. Okay, so the immune system will send its fighters, lymphocytes, to fight against this infection, and as a response you can see sago grain like appearance. What is it? Sago grain like appearance in the upper palpebral conjunctiva. Idaneyana upper palpebral conjunctiva ennu paraya. Ivide can ee white picture kando adana sago grains, and similar to that you can see the appearance here. So first point endana sago grain appearance. Basically lymphocytes inde aggregation aanu ee site il undavunnathu, adondana ee sago grain appearance undavunnathu. Okay, fine. Next is papillary hypertrophy. Papillary hypertrophy ennu vechal there are tissues which have small blood vessels. Okay, so they are called as papillae. So again, because of immune response, you can see in the conjunctiva, this is called as palpebral conjunctiva, you can see papillary hypertrophy. Okay, next is pannus. Pannus nu parnal see, you can see neovascularization around the cornea. Cornea or avascular structure ana. Okay, nothing should disturb it. But here, conjunctiva, I told you, trachomalar conjunctiva is infected, conjunctival scarring undavarundu, chronic inflammation karanam, and contraction of the conjunctiva can happen. So because of this contraction, the conjunctiva is getting pulled towards the cornea, and evidekka scarring undu avadekku endu pattum? Neovascularization undavarundu. Appo conjunctiva ne onu samadhanaപ്പെടുത്താനായിട്ടാണ് avade conjunctival neovascularization undavunnathu. പക്ഷേ since conjunctiva is pulled towards the cornea, neovascularization can occur around the cornea, and this is called as pannus. Again, that is bad for the cornea. Cornea should can do its work well, refraction. Fine. So next, okay, Herbert Spitz. This is very, very important. This trachoma, if they want to ask you a question, most probably they'll ask you this question. You can see these marks here. Okay, limbus ariyalo, the junction between the cornea and the sclera, that is called as a limbus. Okay, a limbus, upper limbus inathu trachoma ulla, healed trachoma ആയിട്ടുള്ള ഒരാളിൽ എന്ന് വെച്ചാൽ നേരത്തെ ട്രാക്കോമ ഉണ്ടായിരുന്ന ഒരാളിൽ you can see these spits എന്ന് പറയാം. Basically trachoma ഉണ്ടാവുന്ന സമയത്ത് again the follicles, the lymphocytes come and fight against the infection, so they form follicles at this site, upper limbus, and once infection is gone, the lymphocytes will die and these follicles will collapse. Adineയാണ് നമ്മൾ Herbert Spitz എന്ന് പറയാം. Can you see these depressions here? ഇതാണ് Herbert Spitz. Okay, now answer the question. Herbert Spitz, it is seen in which condition, guys? It is seen in trachoma. Please don't forget it. Okay, short question ana. Later stages, okay, trachoma as it progresses, you can see again, because all this happens because of immune response, you can see a white line over the upper palpebral conjunctiva, that's called as Olds line. Okay, and again conjunctiva, see there is scarring happening in the conjunctiva is getting contracted, and because of this contraction it will pull the lid ഇൻവേർഡ്സ്, അതിനെയാണ് ഞാൻ എൻട്രോപ്പിയോൺ എന്ന് പറയാം. ഇങ്ങനെ നടക്കുമ്പോൾ ഈ ലിഡിന്റെ കൂടെ ഐലാഷസ് വിൽ സ്റ്റാർട്ട് ടു ഡിസ്റ്റർബ് ദ കോർണിയ. ഓക്കെ, സോ സി വെൻ എൻട്രോപ്പിയോൺ ഹാപ്പൻസ് ദർ ഇസ് ഗോയിങ് ടു ബി മിസ്ഡയറക്റ്റഡ് ഐലാഷസ്. അതിനെയാണ് ഞാൻ എന്ത് വിളിക്കുന്നത്? ട്രിക്കിയാസിസ്. ട്രിക്കിയാസിസ്, ആൻഡ് ബിക്കോസ് ഓഫ് ട്രിക്കിയാസിസ് വാട്ട് ഹാപ്പൻസ്? ദ കോർണിയ ഈസ് ഗെറ്റിംഗ് see look here, the cornea is getting irritated. This can lead to corneal ulcer if not treated. Corneal opacity. Corneal opacity means what? It can lead to vision loss or blindness. Okay, so and trachoma, you should know what is fistula classification, you should know what is safe strategy. Safe strategy, that is the treatment of trachoma, very important, please go through it. And what is the inclusion body that you see in the conjunctival cells in trachoma? That is HP bodies, Halberstader Provasic bodies. It is again a P by Q. Okay, so that is it guys. I'll see you all in the next session. It was a quick session on trachoma. Image based questions usually come from this topic, and yeah, read about safe strategy. Okay, bye bye.